On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Garner Newton, Dr. Michael Musacchio, Dr. Robert Wyatt, Dr. John Dulemba.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network featuring Forest Park Medical Centers. Of course, the top medical center in the entire Dallas-Fort Worth area.
And we've got a great show for you today. Let's start off with our first Forest Park doctor. It's orthopedic surgeon, Dr. Garner Newton.
The meniscus is a structure inside the knee that acts like a shock absorber. It's commonly injured with any twisting type motion. There are different signs and symptoms that occur when somebody tears the meniscus. The most common one is pain. It's usually on the inside or outside of the knee, depending on which meniscus is torn.
I was basically experiencing a lot of knee pain. Activities were limited because of the knee pain. I finally decided I had to go see Dr. Newton when the pain just became too much, and I felt like even with rehab, anything I did, the pain wasn't improving.
This is a model of the knee, and what it shows here are the two meniscus. This meniscus here is the lateral meniscus. It's on the outside of the knee where you see this small bone here, the fibula. The medial meniscus is right here. That's on the inside of the knee. The way these structures are torn usually is a sudden twisting type motion. When the femur twists on the tibia, that causes a tear. Once a patient's diagnosed with a meniscus tear and they've proven to have failed non-surgical treatment, then the treatment for a meniscus tear would be arthroscopy. That's simply making 3, maybe 4, but even sometimes 2 small incisions to go in there and trim that tear out. It's an outpatient procedure. It usually only takes about 20 to 30 minutes to do, and the patient, for the most part, is walking right away. I think the most important thing after somebody's undergone meniscus surgery is to try to prevent future injury to their knee in general. The way to do that is to keep up the therapy exercises that they've worked so hard with in those 3 to 4 weeks after surgery on their own, so that they're conditioned, they're dynamically stable, and they basically are at less risk of re-injuring that knee.
My husband and I live about 4 hours from Dallas, and it is every bit worth the drive to come and see a doctor such as him. You get great care with him. He cares about you. Like I say, he truly cares whether you recover, and I think as a patient you have to believe that.
The problem of misdiagnosis in terms of where people believe they have pain and where it really originates is extremely common, and almost seems like it's getting to be more so as patients take medical care into their own hands a bit more these days.
The pain would present itself where it would be a dull ache at times, and then it would transform into the shooting pain. It would radiate out from my hip and go across my abdomen and straight down my leg. And whenever I would walk, I would feel like a stabbing pain in my hip and in my upper leg.
The spine is usually the culprit, either the neck or low back. All the signals that we get from different body parts, signals of pain from arthritis or from an injury, have to be transmitted through the spinal cord to get to the brain. And any short circuit along that pathway can be misleading.
When I first saw Dr. Saadi, he took a very conservative approach towards my pain, and he sent me to see an anesthesiologist, and we tried to do some nerve blocking procedures, and that was one of the things I really enjoyed about Dr. Saadi. He wasn't rushing to put me under a knife right away. Eventually, the pain was not going away, and the anesthesiologist said that there was nothing more that they could do for me, and so Dr. Saadi then recommended the T-lift procedure for me.
Once the determination was made as to where his pain was coming from, we came up with the procedure, which is called a decompression and minimally invasive fusion, which is creating more space around the spinal cord for the nerves to exit freely and then stabilize the motion segments.
This procedure was a life-changing procedure, nothing short of that. Before the procedure, I'd wake up with pain and stiffness. 30 days post-procedure, I feel like I can do the activities that I've done when I was back in my 20s and 30s. Both the visit to Dr. Saadi as well as my experience at Forest Park were extremely positive. And I'm happy to say that the outcome was positive because I can sit here today and tell you that I'm 100% pain-free. And that is the ultimate measure of my success.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
Infertility itself is tough enough to experience alone. A lot of patients do feel like they have nowhere to turn to, but fortunately, we're here in the community. We're lucky that at Dallas IVF, we have a one-stop shop type of center where the patient can come and receive a whole wider range of treatments and to help them get pregnant.
Some couples come to us because there's a male factor, sperm is poor. Some couples come to us because the woman has endometriosis or does not ovulate well. There's a whole range of reasons why couples come to us. About 15% of the patients we see in the office have what's called unexplained infertility. They have a completely normal workup, yet they're still unable to conceive.
Here at Dallas IVF, we offer a wider range of infertility treatments, ranging from basic aggressive therapy like taking medicines such as pills to grow an extra 1 or 2 eggs, combined with something called insemination or IUI. That's where we'll take the partner sperm and place it closer to the eggs within the uterus. Another treatment that we offer is a very aggressive treatment called IVF, also called in vitro fertilization. What that is where everything that occurs in the tube, which is particularly fertilization and embryo development and growth, all that occurs in a glass dish in the lab. So in that way, we can actually find the healthiest embryo and place those back into the uterus.
If there's a structural reason why they can't conceive, the tubes are blocked, there's fibroids, polyps in the uterus, endometriosis. For these people, we often have to take them to the operating room and try and correct those abnormalities. We're fortunate we operate at Forest Park Medical Center at Frisco, which provides the full range of services that we need on all our surgical patients.
Infertility and infertility treatments is like an emotional roller coaster. Hope and excitement followed by despair and frustration, followed by hope and excitement. But one day, there will be a little baby at the end of the road. It's so rewarding, especially when the families come back and they are so excited to show us their little child. It really is the best part of what I do.
Bill has a question for Dr. Glenn Ihde. What is a hiatal hernia and how can it be treated?
A hiatal hernia means that some of the stomach has herniated through an opening in the diaphragm called the esophageal hiatus. The opening is normally small, 1 centimeter or 2 across, for the esophagus to go through. When it dilates, the stomach can move up into the chest, and when you breathe, the negative pressure of the chest opens the junction between the esophagus and the stomach, and that makes reflux that much worse because it allows acid to move past the valve, and it also pulls acid up into the esophagus. To fix a hiatal hernia, we would make little incisions, usually about 5 millimeters, which is about 1/2 inch, under the rib cage, usually 4 of them, to go in, free up the stomach, pull it back down into the abdomen where it's supposed to be, and put sutures to close that opening down to the right size.
All of the doctors here at Forest Park Medical Center are dedicated to changing people's lives. Like our next best doctor, it's neurosurgeon Dr. Michael Musacchio.
A very common patient we see is a patient who has lumbar stenosis. Lumbar stenosis is the most common condition that we treat surgically in any patient over the age of 55. but it can really happen earlier in life, even as young as the 30s. What stenosis is a series of changes in the spine that results in the nerves becoming pinched by disc bulging, thickened ligaments, arthritis in the joints. And as the spine becomes more narrow, the patient develops aching and pain through their back, sometimes through their buttocks and all the way down their legs. It can be very debilitating. It can affect the way they walk, it can limit their activity level, and it can be quite painful. With those patients, we like to follow a conservative approach, if possible using therapy, sometimes chiropractic care, injections, pain medications, and behavior modifications. But as the disease advances, it might require surgical intervention. Traditional surgical methods can include open laminectomy approaches, which involve large incisions and muscle splitting approaches. They can be debilitating, painful surgeries. Newer advances in technologies in our field involve what we call motion-preserving technologies. These include such things as artificial disc replacement, and in some cases, interlaminar stabilizing devices, one of which is called a Coflex. The purpose of these products is we want to stabilize the spine and decompress nerves, but not necessarily have to fuse the spine or put screws and rigid constructs in the spine. We want to help the patient preserve their normal anatomy. The purpose of this is to help the patient's current condition of back and leg pain, but hopefully prevent problems in the future. With posterior approaches, we can use something called a Coflex or an interlaminar implant. It's a flexible titanium device that after we decompress the spine, we can place this in the back of the spine. It helps stabilize the spine, it helps preserve the patient's normal motion, it relieves the back and the leg pain, and ideally, it will create more stable spines so that they don't have problems resurface in the future. Motion-preserving devices are intended to decompress the spine and help back and leg pain, but by restabilizing the spine with the artificial disc type device, we're able to avoid fusions. The benefit of this is maintaining the patient's normal spine motion, and ideally down the road, they have less problems, less need for surgery, less pain, and hopefully protects the remaining levels of the spine from degenerating in the future.
The Da Vinci robot has been used extensively in gynecology since about 2008, and it allows us to do major surgery on patients that used to would facilitate a large incision, but now we're able to do these through smaller, minimally invasive incisions, allowing the patient quicker recovery and quicker return to normal activities.
I work a full-time job. I perform on the weekends. I'm a jazz blues singer. The recovery time seemed to me to be a little bit more because of the weight issue. But the robotic procedure kind of lessens that fear.
Wanda was having a lot of pressure down below, and she stated that she felt like things were changing inside of her. She knew she had the fibroids, but she felt like they might be growing again. We did a sonogram. It showed that her uterus and fibroids collectively were about the size of a volleyball, and definitely could be causing the pressure and the abdominal pain that she was experiencing. It's kind of like a muscle cramp in the uterus. And unlike muscle cramps in our other muscles, these muscle cramps don't go away, they stay.
He explained the process to me, and I said, this is the person who's going to do the surgery. And the procedure was done. And within less than 2 weeks, I did a performance. I was very pleased with the outcome.
Well, we did her surgery in mid-afternoon or so, and I saw her that night, and she says, I really could go home right now, but I think I'll just stay. So we kept her overnight. The next morning, she felt great, and she was ready to get out of there. I saw her back about 2 weeks later, and she had already done her first performance. I think she said it was 10 days from the time she had her surgery to the time she was back on stage.
I know my doctor said, don't do anything, don't drive for at least 3 or 4 days, but I felt good, you know. So, you know, I would recommend this to anyone who is thinking about having this procedure.
You know, Jim, not only do some of the best physicians operate right here at Forest Park Medical Center, but they're using some of the most advanced, latest technology.
Exactly right, Candace, like the Mako robot used by orthopedic surgeons right here out of beautiful Forest Park Medical Center.
Before we even start the surgery on the patient, we actually review the plan. The 3D analysis that was obtained from the CAT scan allows us to see the knee in real time. And this allows us to see the orientation, the alignment, and actually the size of the implant that we'll use. So I can actually look with 3D technology to see exactly what the implant looks like, the alignment, the rotation. As we get into the surgery, I can actually make adjustments in surgery to balance the ligaments inside of the knee as well. So once we place these pins into the bone, we attach what we call arrays to the pins. And this allows us to consistently always know the position of the bones at all times. Once we register both the patient's anatomy and register the robot, then the next step is to actually begin the surgery itself. So I can slowly chisel away the bone that's necessary. When I look at the screen, the green data tells me the extra bone that I must remove. What's critical is this robot will not allow me to go outside of the plan that we've instituted in the very beginning of surgery. The surgeon is actually still doing the surgery. The robot is just allowing the surgeon to do it in a more precise manner because the robot will not let me deviate from the plan at hand. Then the next step is to trial or place the implant to see if it fits correctly. And as you can see, it's perfectly aligned, the rotation is perfect, and as a surgeon, it's very exciting to see that we can do this reproducibly, consistently, and do it successfully. This technology allows us to do surgery with the smallest incisions possible. Our patients are recovering much quicker than the traditional approaches.
Coming to see Dr. Wyatt, I was constantly clogged, my nose, constantly having to blow my nose. I was carrying toilet paper around with me constantly and was just miserable. I couldn't smell at all, had a hard time tasting, and it really affected my lifestyle.
Jenna has been a patient of mine for a long time now, and she has very serious problems with sinus infections, sinus polyps, allergies, and associated problems with asthma.
I wanted to find out what was going on so I could breathe better and be functional.
She has a lot of problems with chronic sinusitis, with the formation of a lot of polyps. It's driven by her allergic disease and underlying inflammation that she has all the time. One of the big problems she has is something I see very commonly where sinus problems are making asthma worse.
He explained to me that I had a lot of polyp development in my nose and that he needed to remove them so that way I could breathe better and that way everything would flow more clearly and I would be able to smell as well.
So one of the things that happens to her when her sinuses start causing trouble is her asthma gets a lot worse. I would never be able to cure her, but I would be able to dramatically improve her quality of life by cutting down on the medicine she had to take all the time, improving her breathing through her nose, her sense of smell.
Dr. Wyatt has changed my life in many ways. First of all, being able to smell my own perfume. Yeah, he's definitely changed my life. I can taste food again, I can make trips with my husband, and I can have a normal life. I love being able to smell flowers.
And she's one of those people, unfortunately, that I have not been able to go in and cure with a single surgery, but because of the minimally invasive techniques that I'm able to employ now, even though she requires surgery to clear out polyps every 18 months to 2 years or so, she's able to get that done and tolerate that with very little downtime.
He is a great doctor. I love that he explains things to me well. He shows me things. He helps me out with new medications if I'm on them. He coordinates really well with other doctors. I just love Dr. Wyatt and his team. I would definitely recommend Dr. Wyatt.
Did you know that Forest Park Medical Centers are designed and constructed to meet or exceed the standards of the U.S. Green Building Council's Leadership in Energy Environmental Design LEED program? The purpose of LEED is to reduce energy and resource consumption, minimize environmental impact, and provide healthier, more connected buildings. Throughout the building and grounds, you will see signs which highlight Forest Park's sustainable efforts. For more information about Forest Park Medical Centers and, of course, the outstanding doctors that operate right here out of Forest Park Medical Center, head to the website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab. Right now, it's time to head to our next best doctor operating right here out of Forest Park Medical Center. It's gynecologist Dr. John Dulemba.
Endometriosis is glandular cells similar to the lining of the uterus that gets where it doesn't belong. It can get on the bowel, the bladder, the uterus, the tubes, the ovaries, in their liver, in their lungs. This is a disease that can get almost anywhere, and it's not a malignancy, it's not cancer, but the symptoms that it produces are so life-interfering that it feels like a life-threatening problem. They can't function. And it grows with hormones. And all of this is related to their immune system. Women are more likely to have lupus, rheumatoid arthritis, hypothyroidism. They have problems with their bladder where they pee a lot during the day and there's blood in the urine. So because of the immune system, this disease continues to grow. They can't eradicate it, they can't get rid of it. And it does grow with their own hormones or even artificial hormones such as birth control pills. How do I know when to go to the doctor? If your symptoms are interfering with your normal functions, that's the time to go see a doctor. If you wake up in the morning with your cycle and it hurts a little bit, and you don't even have to take any medication, maybe you don't need to see a doctor. If you have to take any pain medication, if you have to lay on a heating pad, if you can't go and have fun with your friends or your family and do your normal activities, that's the time to seek help from somebody who deals with endometriosis on a daily basis. The way to cure and get rid of as much endometriosis as you can is actually to cut it out. We outline it and then lift the tissue up and then cut underneath so that we have normal tissue that we take out along with the endometriosis. So by doing this, we eradicate as much endometriosis as we possibly can. Any place where this disease is at, we have to excise it / cut it out so that we give that patient the best opportunity to be as symptom or disease-free as we can. The goal of this is to treat this disease early. If we can treat this disease early, we have a much better success rate in eradicating this disease so that a woman can go on and have a very functional life. And early treatment is key to this.
A lot of people are under the misconception that varicose veins are strictly a cosmetic problem, but there's a real underlying medical condition in most cases that require treatment.
The symptoms I was having with my varicose veins were swelling, itching. I had a lot of leg pain, a lot of leg fatigue at the end of the night when I would get home. And I've had this for 20-some years. And after I had my 2 children, it has progressively gotten worse over the years.
The typical patient that may come in would be of childbearing age or a little bit older and have long-standing symptoms of leg heaviness, leg pain.
The procedure is an endovenous ablation procedure. It's kind of on a newer technology. In the past, this procedure was performed with vein stripping, which was a very barbaric procedure. Now it's refined and where it uses a small incision in the leg, about the size of a grain of rice, and then you put a little catheter up the diseased vein, and you basically deliver some radiofrequency energy, which causes the vein to heat up and close.
The procedure itself was very short. I went into Forest Park Medical Center and I was treated great. I was in and out within a couple of hours, and I had hardly had any pain at all the next night, and then the next day I was completely pain-free.
The patients go home with a wrap and a few bandages around their leg. There's no large incision to be taken care of, and then usually we see them back within the office within 3 to 5 days of the procedure, at which time we do an ultrasound to make sure that that vein is closed, and that's typically all the follow-up that's needed with this procedure.
If you think you have varicose veins or chronic venous insufficiency, it's always good to get diagnosed, have some sort of working diagnosis. That way we can give you tips on how to halt the progression of your disease.
Today my varicose veins are completely gone and the swelling is completely gone.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
she was born, we noticed that one of her ears was flat. The curve wasn't formed correctly. And our pediatrician noticed it also and referred us to Dr. Travato's office.
About 20 to 30% of all infants are born with an ear deformity. Over the first week of life, that deformity resolves on its own in most cases. But in about a third of that 20%, the deformity doesn't resolve. And that deformity, once the cartilage firms and hardens, is there with that child for the rest of their life. What we aim to do is try to help parents and physicians identify those children with deformities and decide whether or not we can intervene early in order to correct that deformity non-surgically rather than waiting until that child is 7 or 8 years old.
Being that she came in so young, they knew that the ear wells would work for Emma. They were very soft. They didn't bother her at all, and they were interchangeable. When they would fall off, we could put another one on. She wore them for about 9 weeks, and I think they worked great. Much easier than having to do surgery at a later date.
By intervening early, we use a system, a device that molds the ear cartilage, shapes the ear cartilage while it's still soft, and then once it hardens in that first 3 to 4 weeks of life, we remove that splint on the ear, and the ear is then perfect. Emma came in basically the same way that most of the infants do. Mom recognized that there was a crimping to the child's rim. What we did was we applied the ear well and molded Emma's ear and corrected that rim deformity. We were able to get her into the office in about the first 2 weeks of life, and so that enabled us to intervene.
Emma's doing great today. She's a very happy baby. Her ears are perfect, and we are so happy that we came to Dr. Travato. Our overall experience was amazing.
Diane has a question for Dr. Dan Aldrich. How do I know I have broken a bone?
A lot of people grow up being told by their mothers or other family members, whoever plays the doctor in the family, that, well, if you can move it, it's not broken. I know I was told that when I was a kid. That's definitely not true. Even if something's really badly broken, you can still move it. The signs of a fracture are pretty consistent, though. It's going to be pain that does not resolve but gets worse over the first 2 or 3 days, and the same thing with the swelling. A simple injury will often feel better the first or second day. With a fracture, it does not. It tends to feel worse, especially for the first several days. It becomes more painful, more swollen, very difficult to move. Some movement can be done, but it's definitely not your normal movement. Those are signs. Bruising, if there is any discoloration that occurs quickly, bluish, greenish, that's a sign you've got a fracture. Significant swelling that doesn't go away after the first day or two. Those are all signs that you might have a fracture. And difficulty with weight bearing, if you can't put weight on it after a couple of days. Those are all signs that you probably need to get an x-ray.
That will do it. That'll wrap up another edition of the Best Docs Network featuring beautiful Forest Park Medical Centers, of course, the top medical center in the entire Dallas-Fort Worth area.
And for more information on Forest Park Medical Center or any of the doctors that operate right here, just visit our website. It's bestdocsnetwork.com, and be sure to click on that Forest Park Medical Center tab.
And Candace, for the folks out there who have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. So long, everyone. We'll see you next week.